Question 21. A patient with Crohn's disease is admitted after 4 days of diarrhea. Which of the following urine-specific gravity values do you expect to find in this patient? A. 1.005. B. 1.011. C. 1.020. D. 1.030. Question 21 Answer: D. 1.030. Question 21 Explanation: The normal range of specific gravity of urine is 1.010 to 1.025, a value of 1.030 may be seen with dehydration. Question 22. Your goal is to minimize David's risk of complications after a herniorrhaphy. You instruct the patient to A. Avoid the use of pain medication. B. Cough and deep breathe Q2H. C. Splint the incision if he can't avoid sneezing or coughing. D. Apply heat to scrotal swelling. Question 22 Answer: C. Splint the incision if he can't avoid sneezing or coughing. Question 22 Explanation: Teach the PT to avoid activities that increase intra-abdominal pressure such as coughing, sneezing, or straining with a bowel movement. Question 23. Janice is waiting for discharge instructions after her herniorrhaphy. Which of the following instructions do you include? A. Eat a low-fiber diet. B. Resume heavy lifting in 2 weeks. C. Lose weight, if obese. D. Resume sexual activity once discomfort is gone. Question 23 Answer: C. Lose weight, if obese. Question 23 Explanation: Because obesity weakens the abdominal muscles, advise weight loss for the patient who has had a hernia repair. Question 24. Develop a teaching care plan for Angie who is about to undergo a liver biopsy. Which of the following points do you include? A. You'll need to lie on your stomach during the test. B. You'll need to lie on your right side after the test. C. During the biopsy you'll be asked to exhale deeply and hold it. D. The biopsy is performed under general anesthesia. Question 24 Answer: B. You'll need to lie on your right side after the test. Question 24 Explanation: After a liver biopsy, the patient is placed on the right side to compress the liver and to reduce the risk of bleeding or bile leakage. Question 25. Stephen is a 62-years-old patient that has had a liver biopsy. Which of the following groups of signs alert you to a possible pneumothorax? A. Dyspnea and reduced or absent breath sounds over the right lung. B. Tachycardia, hypotension, and cool, clammy skin. C. Fever, rebound tenderness, and abdominal rigidity. D. Redness, warmth, and drainage at the biopsy site. Question 25 Answer: A dyspnea and reduced or absent breath sounds over the right lung. Question 25 Explanation: Signs and symptoms of pneumothorax include dyspnea and decreased or absent breath sounds over the affected lung, right lung. Question 26. Michael, a 42-years-old man is admitted to the med-surg floor with a diagnosis of acute pancreatitis. His BP is 136/76, pulse 96, RISPs 22 and temp 101. His past history includes hyperlipidemia and alcohol abuse. The doctor prescribes an NG tube. Before inserting the tube, you explain the purpose to patient. Which of the following is a most accurate explanation? A. It empties the stomach of fluids and gas. B. It prevents spasms at the sphincter of Oddi. C. It prevents air from forming in the small intestine and large intestine. D. It removes bile from the gallbladder. Question 26 Answer: A. It empties the stomach of fluids and gas. Question 26 Explanation: An NG tube is inserted into the patient's stomach to drain fluid and gas. Question 27. Jason, a 22-years-old accident victim, requires an NG tube for feeding. What should you immediately do after inserting an NG tube for liquid enteral feedings? A. Aspirate for gastric secretions with a syringe. B. Begin feeding slowly to prevent cramping. C. Get an X-ray of the tip of the tube within 24 hours. D. Clamp off the tube until the feedings begin. Question 27 Answer. A. Aspirate for gastric secretions with a syringe. Question 27 Explanation. Aspirating the stomach contents confirms correct placement. If an X-ray is ordered, it should be done immediately, not in 24 hours. Question 28. Stephanie, a 28 years old accident victim, requires TPN. The rationale for TPN is to provide a. necessary fluids and electrolytes to the body. B. Complete nutrition by the IV route. C. Tube feedings for nutritional supplementation. D. Dietary supplementation with liquid protein given between meals. Question 28 Answer. B. Complete nutrition by the IV route. Question 28 Explanation. TPN is given IV to provide all the nutrients your patient needs. TPN isn't a tube feeding nor is it a liquid dietary supplement. Question 29. Type A chronic gastritis can be distinguished from type B by its ability to a. cause atrophy of the parietal cells. B. affect only the antrum of the stomach. C. thin the lining of the stomach walls. D. decrease gastric secretions. Question 29 Answer. A. cause atrophy of the parietal cells. Question 29 Explanation. Type A causes changes in parietal cells. Question 30. Matt is a 49 years old with a hiatal hernia that you are about to counsel. Healthcare counseling for Matt should include which of the following instructions? A. Restrict intake of high carbohydrate foods. B. Increase fluid intake with meals. C. Increase fat intake. D. Eat 3 regular meals a day. Question 30 Answer. B. Increase fluid intake with meals. Question 30 Explanation. Increasing fluids helps empty the stomach. A high-carb diet isn't restricted and fat intake shouldn't be increased.